This is our patient here, Miss Cross. She has suffered from a right parietal stroke and has some left neglect. For this purpose, we're going to have her left arm be a hemiparesis arm, and she's going to demonstrate left neglect by preferring to turn to her right side. For this treatment session, we're going to use brushing her teeth. So I have a toothbrush, and this is usually the typical style toothpaste you see in the hospital. And since we were discussing like acute care, I wanted to go with something similar to what the hospital may have. For her items, I'm going to place the toothpaste on kind of more towards the center, a little more towards the right, so she can identify it quickly. But I'm going to have her scan and look to see if she can find the toothpaste if I sit it more over to the left. Will she be able to scan that area of the counter and locate that item? So I'm sitting these items there. Okay, so you're going to be turned more towards the right. Okay, so when I go up to her, I'm going to ask her, I'm going to first come over on this side and greet her, and I'm going to say, "Hi, Miss Cross, is it okay if I touch you?"
Yeah.
Yes, okay, thank you. I'm going to stand on your other side, and we're going to get your teeth brushed this morning, okay? All right. Alrighty, so I'm going to do my best to ask her yes or no questions and take my time and allow her time to answer me as well. So, Miss Cross, do you feel yourself kind of pull to the right? Can you look in that mirror for me and turn yourself to the middle? There you go. Very, very, very nice. Okay, do you see that toothbrush there in front of you? Can you grab that toothbrush? Very, very good. Now I want you to look. Do you see the toothpaste anywhere?
No.
No. Okay, can you look over here towards me? Look towards me. There you go. Hey, there's those eyes. Now I want you to look. Look over here in this area. So I'm kind of giving her a visual cue here. Look in this area. Do you see the toothpaste now?
Yes.
Okay. Can you reach over there and grab that toothpaste? Very good. Now, we're a hemi, right? So she only has one hand, and that has a screw top. So I'm going to see if she can figure it out. Give her a few minutes, see if she can figure out how to open the toothpaste. Can you get that toothpaste open?
Yes.
Okay, how are you going to get that open? Very great idea. Good job. So if you're going to have a patient do this, definitely going to stay close by. Make sure that cap doesn't end up in her mouth. Okay, so what are we going to do to get the toothpaste onto this toothbrush? Very nice. So you can't see it here, but she's using one hand to squirt that on there. You can even teach her to use her hemi arm and put it on the counter and trap that toothbrush to be still so it's not wobbling around while she's in there. Okay, Miss Cross, can you go ahead and pick up that toothbrush and start to brush your teeth?
Mm-hmm.
Very good. All right. Oh, look. You're kind of turning again. Look towards that mirror. What about this side here? What about these teeth? Can you get this side over here? There you go. Very, very good. Good job. Great job. So what I've been trying to do is provide tactile, so I'm constantly touching and rubbing this side. I'm standing to this side to call attention to myself, and I'm also having the visual cues, so I'm doing a lot of scanning and tactile cues, touching the jaw. Of course, all of after I've asked if it's okay if I touch her. You never want to touch a patient without their permission. So making sure that I'm giving that proprioceptive, tactile, and the visual and auditory cues over to the left to call her attention this way. Research has started to show us that if we're doing meaningful tasks while involving this cueing, we're seeing increased success versus it just being a meaningless task, involving these kinds of cues into purposeful tasks. So brushing your teeth, getting your makeup done, getting dressed in the morning, those kinds of things, teaching the family to stand to this side, touch that arm, get our visual cues over here. We're going to start seeing more success sooner. Thank you.